Hello, everyone. I hope I'm audible. Okay, so people are joining. We'll just wait for a few seconds and then we shall start. Okay, so I welcome you all to BabyChakra. Firstly, I would like to thank BabyChakra for giving me this opportunity for live streaming and sharing my knowledge with you all. So, hello everyone. मैं हूँ Dr. Barkha Nagpal. I'm a physiotherapist. I'm into hypnobirthing childbirth education. I'm into ACBE childbirth education and I'm a trained doula. मैं नागपुर से हूँ and my clinic is also in Nagpur. I treat physiotherapy patients. I cater to pregnancy couples, that is the expectant couples. I'm into pregnancy care and exercises. I'm into pregnancy, post-pregnancy care and exercises for the mothers. And I'm into Pilates fitness. So my experience of my complete is 7 years of experience with exclusive experience of 5 years into pregnancy care. So my topic for today is exercises during pregnancy. Yes, so we'll start with the topic. So, before starting with the topic, I would first like to add that whatever information मैं यहाँ पर देने वाली हूँ, ये एक एक्सरसाइज प्रिस्क्रिप्शन का एक गाइडलाइंस है. मैं आपको एक्सरसाइज प्रिस्क्राइब नहीं कर रही हूँ. And this knowledge is for guidelines, like हमें एक्सरसाइज कब करना चाहिए, कैसे करना चाहिए. There will be many guidelines, and this is for knowledge and information. So I'm not prescribing any exercises. So please make note of that, and always remember that exercises during pregnancy should always be done in guidance. आप हमेशा guided exercise program ही choose करेंगे when we are in our pregnancy phase. Okay, so let's start with the topic. Okay, so why should we exercise? The first question is कि हमें क्यों exercise करना चाहिए? तो हमें exercises इसलिए करना चाहिए क्योंकि pregnancy में there are many physiological changes जो होते हैं. So उसमें there is a hormone that is known as relaxin जो release होता है. So because of the release of the relaxin hormones, ये आपके पूरे body में जितने भी joints होते हैं and specifically joints around the uterus, they are going to relax. So because of the relaxin, the muscle needs to work more to hold the joint in place. For that reason, what we have to do is we have to strengthen them because वो relaxin till the time you give birth, तब तक वो relaxin आपका release होते जाएगा. So that means कि आपके joints further they'll keep on growing according to they'll go apart. They'll start opening, and that opening will be according to the growth of the baby. And even the bones will open further during the birthing phase. So for this reason, आपके joints and आपकी muscles जो hold करती है joint को, they are supposed to be very strong. For that reason, we should always and always exercise. Okay, now main reason. This is the main reason. Now one more question that always pops up is हमारे parents ने तो exercise नहीं किया था, फिर हमें exercise करने की क्या जरूरत है? For that, I would like to say कि हमारे parents were very strong. They used to do all sorts of exercises, and they were never sedentary. मतलब they never even had help. So, and the food they ate, the nutrition they had was excellent, of excellent quality. What we are having is obviously there is a lot of change. प्लस उनका जो एनवायरनमेंट था दैट वाज वेरी हेल्दी, पोल्यूशन कम था, अंडरलाइंग प्रॉब्लम्स कम थी. So for that reason, we should always exercise. I always say, I mean, I never shy to say this. Our parents are very strong, and we are not obviously at par with them. So उस रीजन के वजह से हमें एक्सरसाइजेस करना इज अ कंपल्शन, आई वुड से. व्हाई? क्यों? उसके और बेनिफिट्स हैं जो हम आगे देखेंगे. So when should we start with the exercises? Now I have conceived. So हमें exercises कब start करना चाहिए? The exercises should start जब आपका first trimester complete हो जाए. That means from the 14th week onwards, you can start with the exercises. So is it कि हमारा first trimester में हमें exercise नहीं करनी चाहिए? This I would always say, generally जब आप conceive करते हैं, this is for everyone when you conceive. तो by 13 weeks, by the end of the first trimester, आपका pregnancy confirm होता है. For that confirmation, and in that phase, generally it is recommended कि आप exert मत करिए. And it is matter for 3 months, and placenta भी अपनी position attain करते हैं. So even to attain that position, कई बार placenta low lying हो सकता है. So or maybe the कई बार placenta there's something, the condition known as maybe placenta previous, तो हमें पता कैसे लगेगा. So for वो confirm हो जाता है by the end of third month. So after that we should start with exercises. उसके पहले if your gynec is allowing, आपके हेल्थ केयर प्रोवाइडर आपको अलाउ करता है, तो ही आप अपना you will go with the exercises. Otherwise I would never suggest. You can go for nutrition, but don't go for exercises as such. Now so for the first trimester exercise hona chahiye. It is not really recommended. Now, for the second trimester, I would say आपका अभी आप आ गए हैं second trimester में. So from the fourth month onwards, you can start with the exercises. That exercises will keep on continuing till the day you deliver. अब eighth month में there is again one thing. Eighth month में हमें exercises करनी चाहिए कि नहीं करनी चाहिए. अगर हम exercises कर रहे हैं, तो हमें precautions क्या-क्या लेने चाहिए. एथ मंथ में आपका बेबी का रेस्पिरेटरी सिस्टम बनता रहता है, मतलब इट इज अबाउट टू कंप्लीट इन द एथ मंथ. That is the reason why we always recommend that whatever you are doing, you continue. उसका आपको intensity increase करने की जरूरत नहीं है. Now आपको लग रहा है ओके एथ मंथ में आई स्टार्ट विद एक्सरसाइजेस. अगर आप गाइडेड एक्सरसाइज प्रोग्राम, दैट मीन्स यू आर डूइंग दिस अंडर अ हेल्थ केयर प्रोवाइडर, जब आप तब कर रहे हैं, तब यू कैन गो विथ इट. बिकॉज अगर आप एथ मंथ में जब हमारे पास एक्सरसाइजेस के लिए आते हैं, सो व्हाट वी डू इज वी गो स्लो विद एक्सरसाइजेस. एकदम से इंटेंसिटी हम इंक्रीज नहीं करते हैं कि वॉट एवर द अदर्स आर डूइंग फ्रॉम द फोर्थ मंथ, देयर इंटेंसिटी विल बी ऑफ द एक्सरसाइजेस विल बी मेंटेन्ड. Now the other question which really happens is ninth month में exercises करनी चाहिए, बिल्कुल करनी चाहिए. क्या ninth month में exercises change होती है? Absolutely. Ninth month में exercises इसलिए change होती हैं क्योंकि now you have to prepare your body for the labor. So what we do is हमारा baby should come down. So we have to lower the baby. Generally, we say na the baby's head is fixed or not. You must have heard about it. So to fix the baby's head, we have to drop the baby. So when you are in your ninth month, the exercises will change. The exercises that will be, it will be like squatting or duck walk. But again, I would say, please suggest go for a guided exercise. अब why guided exercise? अभी तो ninth month में है, तो we can go for squatting. But कई बार ये होता है that your body is automatically preparing for labor, and आपके मे बी रूटीन के वजह से और मे बी whatever busy schedule you have, उसके वजह से the baby has already dropped. तो जब बेबी ऑलरेडी ड्रॉप हो चुके हैं, तो फिर हम और उस बेबी को ड्रॉप नहीं करेंगे. So for that, you have to again understand कि हमें कब एक्सरसाइज करनी है, कितनी एक्सरसाइज करनी है. That again will be guided by the healthcare provider. Now, when should we avoid exercises? It's a very important thing. कब हमें avoid करनी चाहिए? So it is अगर आपके गायनेक ने आपको ग्रीन सिग्नल दे दिया है कि आप एक्सरसाइज करिए, you actually start with exercises. नाउ देयर कैन बी अ पॉसिबिलिटी शी इज लाइक नहीं आपका मे बी लो लाइंग प्लेसेंटा है मे बी नाउ वो फिफ्थ मंथ में कई बार होता है कि बाय द एंड ऑफ द थर्ड मंथ लो लाइंग प्लेसेंटा गोज हाई because of the as in when your uterus grows the placenta goes rises high by itself. Now there may be a possibility that it did not rise up. So generally by the end of the or by say by the mid so around fifth month आपका placenta will settle in its position. So this is the reason why we should always ask the gynec, is it when is a good time to go in for exercises if you have such conditions. Otherwise, you already get to know by the end of the first trimester, third month, that you are good to go for exercises. Now the other reason, one more reason is आपको exercise कब avoid करनी है. Now you are feeling unusual than usual days. आपको एक sensation सही नहीं लग रहा है. आपको ऐसा लग रहा है मुझे बहुत फीवरिश लग रहा है या वॉमिटिंग जैसा लग रहा है या कॉन्स्टिपेशन लग रहा है या मे बी डायरिया लग रहा है there is pain feeling or there is cramping. So these are few of the reasons when you will not opt for exercises. And अगर आपको इनमें से कुछ भी हो रहा है so to whomever you are going for exercises inform them so that you don't do exercises in such conditions. Now if there is a raised blood pressure even then you have to tell your person that okay the it is going out of proportion तब आपको exercises avoid करने हैं. So कोई भी दिन अगर आपको रेगुलर डेज में कुछ अलग फील होता है तब आपने एक्सरसाइज नहीं करनी चाहिए. मे बी देर इज स्लाइट ब्लीडिंग और एनी ऑफ सच थिंग्स जो यूजुअल नहीं है उस टाइम पे आप एक्सरसाइजेस मत करिए. Now, what are the benefits of exercises? Now we are talking benefits. Benefits आपको क्या क्या फायदे हैं? First of all, it will the exercises they release endorphins. What are endorphins? They are happy hormones. So happy hormones helps us to be happy, calm. So जितने happy and calm आप रहेंगे, उतने ही happy and calm आपके baby रहेंगे. And one more benefit is very important that जब आप exercise करेंगे, you can actually feel increased movements of the baby. So the baby really enjoys the exercises. If not on that time, आपको ऐसा लगेगा कि रात के समय or maybe by the end of the day, a lot of movements are happening. That is actually you have released those endorphins. Those endorphins have gone to your baby, and your baby is really enjoying that. Now the other thing is you will be able to appreciate the changes that are happening in the body. So you will know, okay, now my bump is growing. Now maybe you can feel the movements well. You will be able to understand the routine of your baby. The other thing is appreciating the new body image. This is very important. Why appreciating the new body image? Because there is a burden sometimes कि अगर हमने weight gain कर लिया, क्या हम पतले हो पाएंगे? So that should not happen. But you know that you're eating well, you're exercising. So you know obviously that you are going to be in control. And weight agar gain ho bhi jaye. So that is not a problem. You will revert to your body. You know your body type, and you will revert to your pre-pregnancy self after the birth of your baby. So what I can say is on the delivery table, on the birthing table, it will happen that आपका say 7 to or I can say 5 to 8 kgs you will be losing on the table. उसके बाद जो आपका gain है that will slowly and steadily you have to start losing again with guidance because कई बार breastfeeding phase में अगर आप weight lose करने की कोशिश करते sometimes the supply goes down. Now the other thing, one more thing is mood swings कम करता है. So pregnancy में mood swings बहुत हो गए. So to reduce those mood swings, I won't say that it will stop. No, because we are very high on hormones, so we have to expect those changes. Now aches, pains and discomforts will be very less. आप बेड पे अच्छे से टर्न कर पाएंगे, मोबिलिटी विल नॉट बी अ प्रॉब्लम. देन चांसेस ऑफ स्पॉन्टेनियस लेबर बढ़ता है. दैट मीन्स अपने आप लेबर स्टार्ट होना. जब लेबर अपने आप स्टार्ट होता है देन व्हाट हैपेंस द चांसेस ऑफ गोइंग इन फॉर नॉर्मल और द वजाइनल बर्थ इज वेरी हाई. Then the labor discomforts are also less. And आप initial phase of labor में आ भी जाए आपको पता ही नहीं लगेगा if you're exercising. So your body will be like, okay, I'm used to such strain and muscles are very strong. So strong muscles opens easily. Then the other is birthing is comparatively quick and easy. नाउ पोस्ट प्रेगनेंसी बेबी ब्लूज वो भी कम होते हैं. Plus, if you know, have the idea of it, even that helps. But because there's so much endorphins that have been released in your body, it helps. It gets easier to manage the postpartum blues, or the, in a simple language, we call it baby blues. It also keeps your baby calm, happy, active. And one very important point is, I've seen in many, milestones बहुत जल्दी जल्दी reach होते हैं. So when the milestones are reaching quickly, then obviously, because it's all the blood that you have given to the baby, the increased blood supply during the growth of the baby. Now the benefits are endless. So let's go to another question that really happens is, अगर मुझे underlying problems है, तो क्या exercise उसे treat करने में help करेगा? सो आई वुड से यस. अगर आपको बैक पेन्स है, बैक पेन्स के लिए देर आर मेनी एक्सरसाइजेस दैट कैन हेल्प यू रिड्यूस और एक्चुअली स्टॉप द बैक पेन. Now the other thing is blood pressure. अगर आपका high हो, low हो, that can be controlled with exercises. अगर आपको gestational diabetes है, because whatever is hormonal, that can be controlled with the exercises. Now other is low lying placenta. Yes, even if you have a low lying placenta, there are exercises to ride the placenta upwards. Like in the fifth month, like in the ninth month, we can drop the baby down. So even in the third or the fifth month, where it'll, when you know कि आपका placenta low lying है, that can be raised up. The other thing is, आपको pelvic bone pains होते हैं, मतलब जो हमारी sit bone है. So वहां पर अगर आपको पेन हो रहा है, या लो बैक के स्लाइटली नीचे पेन हो रहा है, that can be sorted. Perineal muscles pain है, even that can be, perineal muscles meaning जो external genitalia के, and that continues inside, those are the perineal muscles. So even that pains can be reduced with exercises. Groin pains है, breathlessness जो extra होती है in the 8th month, because the baby, as the baby is growing, your uterus will go up and it will push the lungs up slightly. So वो उसके वजह से breathlessness होती है. But अगर आप exercise करें, you're opening your chest while exercising, so even that will reduce. Now the inverted nipples, for flat nipples we have exercises. Urinary incontinence कम करने के लिए and maybe stop करने के लिए, we will be it's very helpful. Kegels is very helpful. Now the chances of developing diastasis recti post your delivery is also less. Okay, so now let's come to the parameters or the guidelines, I can say, कि हमें exercises कि what are the parameters that we have to understand. सो एक्सरसाइज कैसे करनी चाहिए, कब करनी चाहिए. ओके, ड्यूरेशन ऑफ एक्सरसाइज पहले बात करते हैं. अगर आप एक दिन, लाइक इफ यू आर, देखिए, इफ यू आर लाइक इन योर रूटीन, आई कैन से 45 मिनट्स ऑफ वर्कआउट, अगर रेस्ट पीरियड गिन रहे हैं तो 1 आवर ऑफ वर्कआउट इज मोर देन इनफ. उससे ज्यादा रिक्वायरमेंट नहीं है. नाउ फ्रीक्वेंसी ऑफ एक्सरसाइजेस कितना होना चाहिए, हफ्ते में 6 दिन. बिकॉज हमारे पास बहुत हाउस हेल्प भी अवेलेबल है. अगर आप वर्किंग भी हैं तो भी आई वुड सजेस्ट कि गो फॉर एक्सरसाइजेस, बिकॉज जो आपको एक्सरसाइज से एनर्जी मिलेगी, दैट विल बी, यू विल बी एबल टू इन्वेस्ट दैट एनर्जी इन वाइल वर्किंग, एंड यू विल बी फॉर द टेकिंग केयर ऑफ योर होम. सो ऐसा नहीं है कि एक्सरसाइज करके आप थक जाएंगे. सो ये एक बहुत बड़ा मिथ है कि अगर हम एक्सरसाइज करेंगे तो हम थक जाएंगे. एब्सोल्युटली नॉट. वन मोर थिंग इज, मैं तो काम करती हूँ, तो एंड मेरा रूटीन बहुत हेक्टिक है, ढेर सारे काम करते हैं, काम के लिए बाहर जाते हैं, इवन उसमें एक्सरसाइज की जरूरत है, बिल्कुल जरूरत है, बिकॉज वो आपका रूटीन हो गया है अब. सो रूटीन से आप जब ज्यादा करते हैं, दैट इज एक्सरसाइजेस दैट विल हेल्प यू टू इंक्रीज योर स्ट्रेंथ. नाउ द अदर थिंग इज हाउ मेनी, फॉर हाउ मच टाइम, अभी आपने खाना खा लिया है तो उसके बाद आपको कितने घंटे बाद एक्सरसाइज करनी चाहिए. दैट एक्सरसाइजेस इट शुड बी डन आफ्टर 2 आवर्स, बिकॉज 2 घंटे लगते हैं. इफ यू आर टेकिंग अ हैवी मील, लाइक आपने लंच डिनर लिया, डिनर के बाद तो एक्सरसाइजेस ऑब्वियसली नहीं करेंगे, मगर आपने बहुत हैवी ब्रेकफास्ट लिया है, आपने लंच लिया है, तो उसके बाद आपको एक्सरसाइजेस 2 घंटे बाद करना है, क्योंकि 2 घंटे के बाद आपका 2 घंटे लगते हैं टू डाइजेस्ट द फूड. फूड डाइजेशन के बाद ही आप एक्सरसाइज करेंगे. अगर आप पहले एक्सरसाइज करते हैं, ऑलरेडी हार्ट इज पंपिंग मोर टू गिव ब्लड टू योर बॉडी एंड योर बेबी. अगर आपने घंटे भर या आधा घंटे बाद एक्सरसाइज कर लिया, अब हार्ट पे प्रेशर ज्यादा हो गया, एक्सर्ट हो गया है हार्ट, अब वो क्या करेगा, आपके हाथों को, पैरों को भी ब्लड देगा, उसके बाद आपके बेबी को भी देगा, टमी में डाइजेशन के लिए भी देगा, फॉर द डाइजेस्टिव सिस्टम. सो द स्ट्रेन ऑन द हार्ट इंक्रीजेस. So we should never do exercises immediately post lunch. The exercises should be done after 2 hours. If you're having a very light meal, like आपने एक बहुत ही स्नैकिंग कर लिया तो उसके 1 घंटे बाद भी चलेगा, बट यू शुड नॉट फील हेवी और रिफ्लक्स हो रहा है, उसमें यू डोंट हैव टू डू। You have to wait again कि डाइजेस्ट पूरा हो जाए खाना, then you go with the exercises. Now, what are the type of exercises that can be done? So, I won't say कि simple walking में आप stop करिए, walking continue कर सकते हैं, उसके साथ-साथ आप like again a guided exercise program. So what you have to do is you have to take strengthening exercises, upper limb, lower limb ka, because upper limb strengthening is very important as you will be holding your baby. So post pregnancy, now I'll say you will be holding your baby say continuously for 2 to 4 years. तो उतना ताकत चाहिए, एटलीस्ट 6 मंथ्स के लिए ताकत चाहिए, उसके बाद बेबी विल स्टार्ट विद क्रॉलिंग, तो आपका हैंड रिलीज होगा, बट फॉर दैट यू हैव टू केटर योर बेबी for a very long duration of time. So we need good strength in the hands. Then you should go for even cardio so that अगर labor में आपका when the in the labor जब आपका baby heart rate is going up and down, your body is used to that. So it will settle that very easily. So you'll be able to bear it. You'll be able to go very smoothly with labor because your body is used to such exertional activities. सो विथ कार्डियो एक्सरसाइजेस, सो कार्डियो भी करना है आपको, स्ट्रेचिंग भी करना है, स्ट्रेंथनिंग भी करना है, गाइडेड एक्सरसाइजेस प्रोग्राम आपने सारे करने हैं. So here, I guess I am done with all the points that are related to exercises. So I take a regular exercise program even on online portal. It's a live exercise program that I take for pregnancy with a couple pregnancy session as well every week. I also take post pregnancy exercises for the mothers. I also take hypnobirthing sessions on the online portal, and I am also into Pilates fitness. Okay, and I would request all of you to follow me on the BabyChakra app. So I guess we can now go up to the question and answer sessions. Okay. So the questions I could see Miss Supriya is asking, when should I start exercises in pregnancy? So you are supposed to start with the exercises in pregnancy once you are done with your first trimester. From the 14th week onwards, kindly start with the exercises, guided exercise program. अपने आप ना करे तो बहुत better है. Now, the other is, does exercises cause miscarriage? So, if you are exercising in the first trimester, then the chances are, that is why we say let the pregnancy confirm and then you have to start with the exercises. Okay, one thing is that if you are following me on the BabyChakra app, kindly use my referral code, that is Barkha, that is Dr. Barkha. The other thing is, okay, I've got one more question from Varsha. I am 20 weeks pregnant. Can I do exercises? Absolutely, you can start with exercises. मगर मर्जी से नहीं, again, आप बिल्कुल पूछिए करें, एंड बहुत सारे एक्सरसाइजेस कर सकते हैं अगर आप गाइडेड एक्सरसाइज प्रोग्राम करते हैं तो. Does exercise cause miscarriage? We just discussed it कि first trimester में मत करिए, and अगर आपका history है of miscarriages, then I'll say again you have to ask your doctor and then start with the exercises, please. Now, can you jump when pregnant? No, please do not jump. But why do not jump? Because we are not used to very heavy exercises. And I'm not talking about the athletes. Now, why I'm not talking about the athletes? Because we have athletes, they are winning medals and Olympics during pregnancy. So we are not talking about them. They run and they play badminton. They do so many things. If you're not used to, your body is not used to, so kindly don't go for it. Do not jump, please. This is again was from Supriya. Now, Supriya, again, how to lose fat during pregnancy? Yes, अगर आप बहुत अच्छे से exercises कर रहे हैं, आपका fat loss होता है. Plus, this will not cause any problem with the growth of the baby. And nutrition पर भी ध्यान रखना है. And आपका you can lose. बिल्कुल lose कर सकते हैं आप. Can you hurt your body while exercising? अगर आपका exercises like अगर आप weights use कर रहे हैं, मगर there is nobody to what should I say, guide you, then assist you कोई नहीं है. So there are chances. I'm not saying कि weight use करने पर आपको problem हो जाएगा. But what I'm saying is अगर guidance नहीं है, अगर assistance नहीं है from anyone, so I would say kindly don't do. Otherwise, there is no problem. And joints actually, now we just discussed in the starting कि relaxing की वजह से joints आपके hypermobile हो जाते हैं during the hypermobile as compared to what you already are. So because of that reason, the chances are there you may hurt. So we have to understand how your body type is, और उसके हिसाब से we give you the exercises. Then I'm very sure you will not be hurting your body. Now there is one more from Lakshmi Mishra. What I wanted, I can during I guess it says when can I start with my exercises during my pregnancy? Again from the 14th week, and you can start with the exercises. Now the other is what extra care should I take when pregnant? In terms of exercise, I have discussed everything. We have to be very cautious, no jumping, bouncing slightly with the shoes on is fine because I do take aerobics, but still I know what my lady is doing or the client is doing. I know that. Okay? तभी I so एकदम अपने आप please मत करिए. How much weight can I pick up in the initial months of pregnancy? That is very personal. It depends upon your strength. कि आपका strength कितना है. This is again by Mrs. Lakshmi Mishra. So this is आपका strength कितने उस पर dependent है. मगर एक तरीका होता है कि अगर आप weight उठा रहे हैं, so let's say कि आप tray उठा रहे हैं. अगर आप tray बहुत दूर से उठाते हो तो कैसा होता है कि weight ज्यादा लगता है. अगर आप पास ले लेंगे तो आपका body will be able to support you. So this is how we are supposed to lift heavy weights that is near to the body plus divide in both the hands. अगर आप सब्जी लेने जा रहे हैं, supposing, so you can take maybe divide the weight, then it is better. अगर आप एक ही साइड में झुकेंगे, then maybe you may get some of the associated problems. How much? Okay, sorry. Now there is, are there any other question? How much weight can be gained throughout pregnancy? You can, actually the distribution is from 10 to 15 kgs. अब distribution कैसा है कि 4th month से weight gains हम calculate करते हैं. मतलब it is how the distribution is. 4th month पे you will be gaining 1, 5th 1, 6th 1, 7th 1. 8th kg, 8th month 2 kgs, and in the 9th month it is 4 kgs. But it is absolutely not necessary कि हर एक जन का weight ऐसे ही increase हो. Now कईयों का first trimester में ही से you can gain some 5 to 10 kgs. I have women gaining 15 kgs in the first trimester, but then they barely increase 2 to 3 kgs throughout the rest of the pregnancy. So again, it differs person to person. Hello, Ramya. Hi, can we go for jogging? If you are used to jogging, then you can go for jogging, मगर intensity थोड़ा low रहेगा. Because joints जैसे हमारे relax होते हैं तो knee पे pressure आएगा, back पे pressure आएगा, low back पे, and even on the sole of the soles and the ankle. So we don't want any kind of pain. The heel may also start paining. So once you ask your healthcare provider, and they will assess कि आपका अभी how are your parameters, and then they'll suggest to go for exercises. मगर आप continuous कर रहे हैं starting से, so you can, but please again ask, I would say. Is it helpful for normal delivery? Absolutely, Varsha. It is very much helpful for normal delivery because आपका again because delivery, the birthing process is hormonal. So उसके वजह से क्या होता है कि आपका the hormones regulate होते हैं. And anyway, this is done by the baby. The birthing is done by baby. But अगर आपका muscle बहुत strong रहा, so you will be able to. I mean, the labor is initiated by the baby. मगर आपका muscle strong रहा, so your muscles will open. When the muscle is strong, it will open easily and wear and tear कम होता है. So it obviously helps. Even it helps in starting the spontaneous labor. What are other queries? How much weight gain? We have discussed this. Do we have specify some exercises for normal delivery? Okay, so for the normal delivery, I would say you have to start preparing from the 4th month. Now, अगर आपने suddenly 9th month में आ गए और now you're saying, okay, give me some exercise, that doesn't happen. But if you're already exercising, I can say कि आप you can do squatting. That will help in getting a baby down. So when the baby drops, the labor generally it assists in initiating the spontaneous start of labor. स्क्वाटिंग के अलावा आप डक वॉक कर सकते हैं, आप स्क्वाट पोजीशन में बैठ सकते हैं. वन मोर वेरी इंपॉर्टेंट एक्सरसाइज इज स्टेयर क्लाइंबिंग. सो इन एनी वे जब आपका पेल्विस हिलता है एंड इट ओपन्स अप, सो दैट इज अ वेरी गुड एक्सरसाइज जिसमें आपको ये असिस्ट होता हो. सो स्टेयर क्लाइंबिंग इज ऑल्सो एन एक्सलेंट एक्सरसाइज. This can be done even during the time of labor to progress the labor, but it is not compulsory. Some women like to sit and conserve their energy during labor, but it really depends what will you like. Okay. Now, is there any other question? Um, which exercises should I do when pregnant? Every kind of exercises if it is a exercise guided exercise program. Everything you can do. Okay. Mm, I guess there are no more queries. Just okay. Okay. So, yes. Will birth ball exercise be efficient in labor? Yes. So, even the birth ball exercises, because see, not every hospital will have a birth ball. But if you have your own, you can carry it. If the hospital is providing, you can absolutely sit on the birth ball and do the exercises that you were taught during the preparatory phase, that is during your pregnancy phase. So it really helps because again it will help to relax the pelvic muscles. What are the pelvic? All the perineal muscles, the muscles that are surrounding the uterus. So वो help करता है and it will when it opens, the more relaxed it is, the more easily you will be able to open. Okay, so yes, it will happen. It will help. Any other queries? Okay, so I don't see any other query coming. Should I wait for a few minutes? Butterfly exercises, yes. The stretching exercises, it really helps. Like okay, there are few butterfly exercises and an amazing exercise because आपका जब it helps in opening the even the inner thigh muscles and even in strengthening. The obviously in strengthening also. It is an excellent exercise. Even it strengthens. Hanji. So whenever you are sitting in the labor positioning, so if you're sitting in recline sitting or if you are sitting in the in whatever position you are sitting, it will help you to open your legs and it really helps. Now the stretchings are really important, so kindly do the stretches. Any other query? Okay. So the exercises, like what you can do is you have to include stretching. There's one very important exercise that is known as the Kegels exercise. So when we are doing the Kegels exercise, when should it be done? The moment you get to know that you have conceived, you can start. What are these exercises basically? It is the exercise जब आप यूरिन रोकने का एक्शन आपको करना है, वो मसल्स को आपने टाइटन करना है. बट इट इज नॉट दैट कि आपने यूरिन को रोकना है, वो नहीं करना है. द मोमेंट यू फील यू हैव टू एम्प्टी द ब्लैडर, काइंडली गो एंड एम्प्टी द ब्लैडर, but never stop the urine, matlab don't hold the urine back. Okay, so how do we do it? Now I am doing my Kegels, I am holding the muscle. ऐसे बंद करके ऐसे रिलैक्स नहीं करना है. You have to hold it for nice 5 seconds initially, then hold it for 10 seconds maybe, then start increasing the count तब तक कि okay, I don't think I need to count, इतना ज्यादा आपका लेंथ हो गया है होल्डिंग का. That is how you have to do. Now these exercises, it helps that your labor goes easy because wear and tear, if a muscle is strong, so the birth path, this is the exercises for the birth path. अगर आपका birth path strong रहेगा, so the strong muscles will always open easily and they will close also easily. Plus the wear and tear will be less. Now the other thing what it will do is urinary incontinence एक problem है. That means कि urine leak करता है even despite of holding you are unable to hold the urine back. So that is the time these exercise come very handy. कई बार हम खांस रहे हैं, छींक रहे हैं या हंस रहे हैं, उतने में यूरिन लीक कर जाती है. So again you have to do Kegels for that also, and this is the first exercise that you will be doing post your delivery. Now you have given birth to the baby. Whenever you feel okay, now I am strong enough, now I think today I feel very good, I think I should start with exercises. Whenever you are ready, it can be within 2 hours, it can be within 2 days, it can be within a fortnight, 15 दिन. उसके बाद जब आपको लगे, first exercise that you have to go with is the Kegels exercise. Now always remember to strengthen your upper back. Upper back is very important because you will be holding your baby. So for holding your baby, you have to strengthen the upper back muscles. Your shoulders should be very strong. Again, for the holding. Now, one more very important point is to maintain the posture. Because आपका मसल स्ट्रांग रहेगा तो posture maintain रहेगा. अब posture जब maintain रहेगा so आपका ना the tummy will not go in front. कई बार tummy goes in front, आपका posture सही नहीं होता, उसके वजह से भी आपको back pain start होते हैं. So maintaining the posture is also a very important thing. How many counts of squat, butterfly exercises, duck walk, stair climbing has to be done? I always say start with the count of 10, do it 3 times in a day first. So that means 30 you have done. Now after some time, okay, you feel now we are starting this in the by the 37th week, the moment you enter, because that is the time your baby has attained the position. Okay, so अब इसके बाद बेबी का पोजीशन चेंज नहीं होता है जनरली. सो उसके बाद आपने 30 काउंट्स किया. ओके, थोड़ा नाउ बाय द एंड ऑफ द डे अगेन यू कैन गो फॉर after 2-3 days, because initially पैर थोड़ा दुखेगा. Then after 2-3 days you can again go for 30 counts more in the evening. Then you can keep increasing. So what I do in my session, when you are nearing, now you're in your 38th week or 40th, you're approaching your 40th week, after every exercise जो एक alternate exercise, like I am doing hands today, हम hand का strengthening कर रहे हैं, alternate squats करिए. So एक घंटे में अगर मैंने 20 एक्सरसाइज, 20 ज्यादा हो गया, बट आई कैन से 15 एक्सरसाइज करिए, तो 15 का ऑल्टरनेट, दैट मीन 7 या 8 बार आप स्क्वाट्स कर रहे हैं. एवरी टाइम यू आर गोइंग फॉर से 10 to 15 counts, or you are going for अगर आप duck walk कर रहे हैं, so duck walk you are going say complete round of, अगर आप मैट ले रहे हैं तो 3 बारी आप मैट, अगर आपका योगा मैट है स्टैंडर्ड योगा मैट, तो 3 बारी या 2 बारी आपने राउंड्स लगा लिया. Now if you're doing stair climbing again आप दिन में you can go for 2-3 flights in one go, then that is enough. But if you feel कि एकदम सब सारा एक साथ नहीं स्टार्ट करेंगे, बिकॉज पैरों में दर्द होता है, फिर अगर आपका लेग्स पेन होगा और बर्थिंग हो रहा है, सो वी डोंट वांट टू टायर यू, और आपका पूरा एनर्जी उसमें नहीं चला जाना चाहिए कि आप, एंड दैट इज व्हाई द ड्रॉप आई ट्राई कि इट शुड बी अटेन्ड बाय से before 38th or around 38th week, the drop should be attained completely. So these exercises we are doing that the baby drops, when the baby drops completely, पूरा head उनका engage हो जाता है, उसके बाद when the labor starts, it's very easy process कम हो जाएगा. The baby will be able to birth more easily with less efforts, because baby has also have to put a lot of efforts. Okay, any other query? I think I have answered all the queries. If you still have any query, kindly follow me on BabyChakra with the referral code DRBARKHA, that is Dr. Barkha, and you can leave in more queries over there, and I will be answering there. Okay. Again, I would like to thank BabyChakra for giving me this platform. Thank you very much. And I hope this session was useful and informative for all of you. Thank you. Have a great day.